Pleased to welcome you to Roadmap to Healthcare Safety in Massachusetts. A 2019 study identified almost 62,000 preventable patient harm events that resulted in over $617 million in excess health insurance claims in a single year in Massachusetts. In addition to the financial burden that medical harm places on providers, payers, and consumers, the human cost to patients, families, and healthcare workers are unacceptably high. I remember so well in the last couple of years of his life, Senator Ted Kennedy was very focused on this issue. And his staff did a pretty serious analysis of what was happening around the country on preventable deaths in the medical care industry. And they came up with over 100,000 deaths in the previous couple per year in the previous couple of years. And so he was very passionate about this. And but here we are 12, 13 years later, and we still got a lot of work to do. The Roadmap to Healthcare Safety for Massachusetts was produced by a statewide consortium of policymakers, providers, payers, and patient advocates, led by the Betsy Lehman Center for Patient Safety. And the plan is, it's an innovative plan to break new ground on safety through investment and change management. Today, healthcare leaders from across the state will present to all of you the roadmap goals and discuss immediate action steps. After we hear from Undersecretary Kiami Mahania, Barbara Fain, the executive director of the Betsy Lehman Center, will introduce a short video. The Betsy Lehman Center is a non-regulatory state agency created to improve the safety of healthcare for everyone in Massachusetts, and as we all know, was named for a Boston Globe reporter and mother who died at the age of 39 in 1994 as a result of a preventable medical error, an overdose of a chemotherapy drug at a leading Massachusetts hospital. Her untimely and shocking death became a catalyst for improvement in patient safety, both in Massachusetts and around the nation. The center has become a leading healthcare safety organization in the nation, working closely with other states, the federal government, and leading healthcare safety researchers from across the country. Its contributions to safety improvement here in the Commonwealth stem from the center's capacity under the terrific leadership of Barbara Fain to support state agencies, the legislature, provider organizations, and other non-governmental stakeholders on critical health safety concerns in the Commonwealth. The forum and our board would like to thank our sustaining funders, Blue Cross Blue Shield of Massachusetts and Bay State Health, as well as the Betsy Lehman Center and the Gordon and Betty Moore Foundation for making this event possible. Please note we are recording this forum, so be careful. So I never am, but anyway, you will receive an email notifying you when the full roadmap recording and speaker slides are available on the Mass Health Policy Forum website. There will also be an opportunity for you to ask questions during each of the panel discussions. I'd like to just take a minute to recognize some board members of our organization. Senator Cynthia Cream, who's done so much in this space from Brookline and Newton. Representative Kay Kahn from Newton. Former Senator Dick Moore, who's not only a former senator, but we worked together in the Clinton administration as well. And Lauren Peters, who's a veteran of state government, and Ray Campbell from CHIA, and four of our distinguished board members, Michael Curry, head of the League of Community Health Centers, Chris Hager, the legendary Chris Hager, I should say, Connie Horgan, who's also legendary from Brandeis, and Ian Lang, who runs the Brookline Mental Health Center. Now I'd like to introduce Kiami Mahania, who is just began quite recently as the new Undersecretary for Health. And as I think everybody knows, Kate Walsh has reorganized the OHHS in much the same way I had it when I was there. She's got an Undersecretary on the health side, this is Kiami, and an Undersecretary on the social services side, who is Mary McGowan, who used to work in state government as well and ran MSPCC. But in introducing Kiami, he's Undersecretary for Health. Before joining the Healy-Driscoll administration, Dr. Kiami Mahania served as CEO of the Lynn Community Health Center, where he led the transition into value-based care. He's a practicing physician in the field of addiction and primary care, and he has a passion for social justice. As we will hear, he is a tireless advocate for patients, safety, and quality care. In his spare time, he is also an assistant professor in the family medicine department of the Tufts University School of Medicine, although I don't think you have a lot of spare time these days. He's a dedicated pescatarian and does not eat meat, nor do I, and is particularly interested in except Republicans anyway, and is particularly interested in the intersection of food, wellness, and the immune system. So without further ado, welcome our new Undersecretary for Health.